An infection is colonization of any part of the body by germ, microorganism, germ, usually bacteria, viruses, or funguses. So if the ear gets colonized by a disease-causing germ, like a bacteria or a virus, less common, or a fungus, then we call it an ear infection. Ear infections per se are not contagious, but you have to understand how we get an ear infection. Actually, there are three parts of the ear. The external ear, which constitutes the outer part of the ear, which we call the pinna, and then the ear canal. And then we have the middle ear, which consists of the eardrum and three small bones in a cavity. And then we have the inner ear, which constitutes of the nerve, which supplies the ear. So all these three parts can get infected. If the external part of the ear gets infected, we call it otitis externa. If the middle part of the ear that gets infected, we call it otitis media. And then the inner ear, if it gets infected, we call it labyrinthitis. None of these are contagious per se, but otitis media, the infection of the middle ear, usually is secondary to upper respiratory infection, or what we call cold, common cold, or infection of the nose and the sinuses. So infection of the nose and sinuses, that is infected. So that way, indirectly, you can say that the ear infection, the cause of the ear infection is actually of infective nature. Infection from one ear from a person's ear to another person's ear is unlikely. That doesn't happen. The first sign will be loss of hearing. The main function of the ear is hearing. So if there is an infection, there will be loss of hearing, or heaviness in the ear, some kind of deafness. There might be pain, might be, not always, but there might be pain. And there might be discharge from the ear, pus or any other material coming out from the ear. These are three main signs of ear infection. The ear has three parts: the external ear, the middle ear, and the inner ear. All three parts get infected by different means. The external ear most commonly gets infected by entry of contaminated materials into the ear. The most common source, contaminated substance entering the external ear, is contaminated water. That is, when you swim or bathe in ponds or in rivers where the water is contaminated, or in poorly treated swimming pools, that is a source of infection of the external ear. Also, ear picking, either with a fingernail or with a safety pin, pencils, people have the tendency to put various things into the ear, including earbuds. All of them can be a source of infection to the external ear. The middle ear, on the contrary, does not get infected directly from the environment. It usually gets infected secondarily. Secondary means the primary infection is somewhere else in the respiratory tract, that is common cold, sinusitis, infection of the nose, that travels up into the ear through a connection between the ear and the throat, which we call the eustachian tube. Through that tube, the infection travels from the nose and paranasal sinuses and a space called the nasopharynx to the middle ear. So middle ear infections are commonly seen as a result of common cold. The inner ear has a totally different source. It can be spread from the middle ear to the inner ear, usually, or at times, very rarely, it might be spread through bloodborne infections. All these three different kinds of infections are treated differently. The external ear infections are usually treated with ear drops, maybe antibiotic ear drops or antifungal ear drops. The middle ear infections are treated with ear drops, usually, but in some of the middle ear infections, a particular category of middle ear infections, chronic middle ear infections, the eardrum has a permanent perforation. So in those cases, after applying antibiotic ear drops to control the discharge, following that, once the ear is dry, then the patient would need a surgery, which we call a tympanoplasty, a surgery to repair the perforation, the permanent perforation in the eardrum. The inner ear infections are treated with intravenous antibiotics. However, a significant number of them, it's quite a serious condition, a significant number of them may end up with permanent inner ear damage, that permanent hearing loss. The risk factors are actually poor hygiene standards when it comes to external ear infections, when people are not very careful about the kind of water in which they are bathing or swimming, or when they are the habit of constantly picking their ears, putting pens, safety pins, and other things into their ear, even earbuds. The middle ear infections are a result of unresolved upper respiratory infection or serious upper respiratory infection from the nose. It travels to the ear. If not treated at the proper time, they can result in a permanent damage to the eardrum. A certain category of ear infections may lead to permanent hearing loss. By permanent hearing loss, I mean something which is not curable. That kind of permanent hearing loss happens when the inner ear or the nerve which supplies the ear is damaged. Then there is another kind of hearing loss which cannot be treated by medications alone, where you need a surgery. It's correctable only by a surgery. That happens when the middle ear is infected and is associated with a permanent perforation of the eardrum. That one, fortunately, it can be corrected by a surgery.